Record this computer. Okay, fantastic. Now record. Okay, very good. So my name is Stefan Harman, PA, owner of Iron Direct Primary Care. Today I'm going to discuss a relatively unknown peptide called Cibinetide, also known as pHBSP or ARA 290. It's got a bunch of names. You'll find all these names on various research articles and compounding pharmacies. And I spent my entire flight to Las Vegas A4M researching this peptide. So it was like, 10 hours of flying time studying this thing. And you're going to learn today that it's a regenerative peptide in a variety of applications, from sarcoid to diabetes, wound healing, small fiber neuropathy. It improves nitric oxide, preeclampsia, cardiac health, inflammation, colitis, lupus, and macular edema. So pretty wild stuff here. A relatively new peptide. You only start seeing research like this out of, Italy and places a couple years ago, like 2018. So Cibinetide is an 11 amino acid peptide agonist of the innate repair receptor, which has been studied in a variety of preclinical models, animal models, and also some human models, which we're going to get to as well. Very cool to see human studies come out. So what is the innate repair receptor? It targets the endogenous paracrine autocrine network, which regulates tissue protection and repair. This homeostatic system, which has been discovered over the past decade, is activated by cellular injury and metabolic stress, which in turn stimulates upregulation of a receptor complex within the type 1 cytokine family. So the old drug that is often going to be referenced in these studies is EPO, erythropoietin, which has been used in medical applications for wounds. It's also been abused by Lance Armstrong famously to increase the red blood cells. This peptide doesn't increase red blood cells, so it doesn't have the same problems that EPO does, which is coagulation. So if you took too much red blood cells, you're going to get too much thick blood and you can get blood clots and problems. This peptide does not do that. That's why it's a novel, very cool peptide, very exciting. So a lot of mouse healing studies where, so it has said here, diabetes characterized by poor wound healing. Um, we all know that diabetes is a huge problem. And so they did this study where they had injured mice. So we're going to look at here a couple studies. One is the stability, very important with peptides, is well stable for at least 1 year in the non-reconstituted form. Reconstituted as typical peptides last a couple months. Dosing. The dosing on this, we're going to get to very specific dosing here. So for the animal studies, it was 30 picograms per kilogram. I think we'll get to the human studies a little bit later, so that makes a little bit more sense. So what does it do? Malondihyde in wound samples valued at day 7 as an assessment of lipid peroxidation in the wounds of the diabetic animals. And so over 7 days, they also looked at the nitric oxide expression in these wounds. They noticed that there was better nitric oxide expression in the diabetic wounded mice. They also looked at histological evaluation of these wounds in the diabetic mouse and showed um, better reepithelialization, new blood vessel formation, and time to complete wound closure. In this experiment of the diabetic mice injected with Cibinetide, they were also comparing it to erythropoietin and also a control, and shown which because EPO has been shown to enhance wound closure in diabetic mice. Full wound closure was evidenced by a closed and uninterrupted linear ridge with no open areas between the sutures. At higher dosages, Cibinetide significantly accelerated the complete wound closure in the animals. In contrast, wounds of diabetic mice fully closed only after 28 plus or minus 4 days. Animals receiving either Cibinetide or EPO exhibited significantly reduced time to complete closure. Interestingly, the time to closure associated with Cibinetide was superior to that of erythropoietin. So that's significant, mostly because EPO has the side effects, while Cibinetide so far, they've not found any side effects with this thing. Here's a couple graphs of the various mice that they studied, Cibinetide versus EPO versus some placebo. So these mice did a lot better. Here's some histological evidence of the improvements, the histological score. Uh, let's move on to a different one, a different problem, corneal nerve fiber size. So this is going to look at small fiber neuropathy, which is a really big problem we're dealing with in long COVID and acute COVID injury, where you're going to see small fiber neuropathy in these people, and there's not a lot of good treatments out for that. So that's why this peptide has interested me because I have these patients. So they looked at, and one really good way to look at small fiber neuropathy is inside the eyes. So if you do these exams of the eyes that your ophthalmologist friends can do, you can see the small fiber neuropathy based off how much um, how much is visible in the eye. So you can see here on the right, poor nerve fibers, and here on the left, a lot of nerve fibers. So corneal nerve fiber size adds utility to the diagnosis and assessment of therapeutic response in patients with small fiber neuropathy. That's basically what this report showed. And then, so the methods, they have 48 control subjects and 81 subjects with diabetes. So this was actually a human study rather than an animal study. They were recruited and they had type 2 diabetes with small fiber neuropathy in the Netherlands. Both eyes were images, and about 2,500 images were selected and reviewed um, for assessment of longitudinal intervention subjects with sarcoidosis and symptoms of painful small fiber neuropathy were also evaluated following ethical approval. They used 4 milligram dose of Cibinetide, and they figured that would provide enough drug exposure to support nerve fiber growth. The sarcoidosis group was characterized by having moderate severe pain at baseline. So what do we see here? Cibinetide improves corneal nerve fiber abundance in patients with sarcoidosis associated with small nerve fiber loss and neuropathic pain. So the sarcoidosis patients frequently is complicated by small fiber nerve loss, which can be quantified using corneal confocal microscopy. I don't know if there's any ophthalmologists here. I've never done this exam myself, but that's what this study used to assess the improvement with Cibinetide. So the methods, they use Cibinetide 1, 4, and 8 milligrams a day. Okay, that seems to be the dose after, we're going to find at the conclusion of this that 8 milligrams seems to be the key dose in Cibinetide. It was compared to placebo. The primary study was change in small fiber neuropathy as looked at the corneal confocal microscopy at 28 days. So results, the placebo-corrected mean change from baseline at day 28 in the 1, 4, and 8 milligrams results. Let's see. So Cibinetide significantly increased small nerve fiber abundance in the cornea and skin, consistent with a disease-modifying effect. The relationship between CNFA and other clinical measures of disease support its use as a surrogate endpoint to assess potential disease-modifying therapies for neuropathy. So two things here. One, Cibinetide helps heal these patients. And two, you can use corneal confocal microscopy to assess improvement of these patients. Because typically, I've had these patients before, you have to send them for a biopsy, and they have to get a biopsy that proves the small fiber neuropathy. And not everybody likes to get invasive biopsies to prove this. So here's some visualization so you can get in perspective. So A, B, and C. So let's see. Distribution of corneal nerve fibers is shown for a healthy volunteer in A, so that's A on the left, compared to that of subjects having sarcoidosis enrolled at baseline B, so that's B, the middle picture. You can see less nerve fiber abundance. And then after 28 days of Cibinetide, 4 milligrams, that's number C. So small improvements there. And some epidermal changes as well in D and E. So D would be, um, so let's see. Skin biopsies immunostained with JAT4 revealed intraepidermal nerve fiber at baseline D. So that's baseline D on the left. And then after Cibinetide 4 milligrams for 28 days on the right. So do we have any pathologists in the chat here that can tell me what I'm looking at? But it seems like there's a bit more nerve growth as I can count. You can count and you can see the nerves 1, 2, 3, 4, 5. There's way more in slide E than D. Pretty cool. Dose-dependent results. They're finding here, so 28 days of dosing, subjects in the 1 milligram and placebo groups exhibited a mean decrease in their nerve fiber abundance. So not better. Uh, but in contrast, there was better nerve fiber abundance in the 4 milligrams and 8 milligrams groups. So that's a significant increase. Following discontinuation of the drug administration, corneal nerve fiber abundance trended back towards baseline. So that's a little bit disheartening to see that they regressed. I wonder if these patients would have to be on this drug long term. If so, it might be an expensive procedure. Mm, But if you can fix their pain and bring back some vision, that'd be kind of cool. Let's move on here. Adverse events. So this is the cool part is that there weren't really adverse events, like not significant compared to like the placebo group. Um, One theoretical concern is whether newly regenerated nerve fibers could adversely affect neuropathic symptoms, so as preclinical models show that new nerve fiber growth is often accompanied by allodynia. Now, I've personally seen this in one patient of mine. He is a paraplegic, and he has a wound on his back, and he can't move very well. So I had administered BPC 157 and thymosin beta 4 to him, and he had the most peculiar result. Now, I've administered this hundreds of times. He had allodynia. He actually had pain in the nerves of his body, almost as if they were like painful. Like he could feel them. First of all, he could feel them, which was like crazy because doesn't have much sensation at baseline because he's paraplegic. So I feel like this allodynia thing is actually a good sign that the drug is working. So something to think about when you're using regenerative peptides that can regenerate nerves is then if you have a patient that with bad nerve pain, yes, they may describe allodynia, but that could indicate that it's actually working for nerve regrowth. So they're talking about the erythropoietin mimetic peptide. That's another name for Cibinetide. Really confusing when you read the literature. There's like all these different names for this peptide. But it is an erythropoietin mimetic, so it doesn't have EPO side effects, but it mimics the benefits of EPO. Preeclampsia is a severe disease of late pregnancy. We all know they get hypertension. It's a big problem, and women can die from this, children can die from this is endothelial dysfunction. We talk about that a lot at CDPM. Dr. Halasa talks about endothelial dysfunction a lot. This Cibinetide seems to modulate endothelial dysfunction. The administration of short chain peptides mimicking the spatial structure of beta erythropoietin chain may become one of the directions of searching for the new drugs for preeclampsia prevention and therapy. Simulation of ADMA like preeclampsia in Wistar rats. So basically, they gave these drugs to rats that induce high blood pressure and preeclampsia. It was mitigated by the administration of Cibinetide at the doses of, approximately what we found before, about 4 milligrams for a human. It corrected the established morpho-functional disorders. The greatest effect was observed at a higher dose. Again, there was a decrease in systolic and diastolic blood pressure by 31.2 and 32% respectively, which is a huge drop in blood pressure. Pretty cool. So we can see this also modulates endothelial dysfunction. We can add this as another drug to our repertoire to modulate this problem, which is the great problem we face in medicine is endothelial dysfunction. So this peptide appears to greatly increase nitric oxide perfusion. So how do they do that? Well, again, when they use the rats. Study of nitric oxide synthesizing function of the endothelium was performed by determining the concentration of final stable nitric oxide metabolites. The administration of basically this toxin to female rats from days 14 to 21 in pregnancy, which is, later stage pregnancy of rats, resulted in a decrease in nitric oxide concentration in the blood plasma by 38% relative to intact animals. And the administration of Cibinetide resulted in a significant increase in the concentration of nitrate ions in the blood plasma in animals with this toxin-induced preeclampsia by 42%. which that's pretty cool. Again, they're using a toxin to induce preeclampsia in rats, but we're seeing nitric oxide improve and blood pressure lowering, which is awesome because I don't know of a whole lot of good drugs and therapies for preeclampsia in women, like natural therapies, like Cibinetide, relatively natural with no side effects we've seen so far. It's dose dependent. More is actually better for this peptide. Mechanism for you mechanism geeks in the chat here. The mechanism of protection is the ability of Cibinetide to selectively bind to heterodynamic erythropoietin receptor. In this case, non-erythropoietic effects specifically attributed to recombinant erythropoietin are realized anti-ischemic, anti-apoptotic, and anti-inflammatory. This contributes to the cytoprotective effects in the fetal-placental complex, reducing the formation of humoral factors that cause endothelial dysfunction and eNOS activation. Some histology here. Inflammaging. We're going to move on to another popular topic at A4M. They always talk about inflammaging and the aging is related to inflammation. Administration of Cibinetide reduces cell and tissue inflammation, mitigates structural and functional changes within the cardiovascular system, leading to amelioration of frailty and preserved health span or lifespan. So this drug can be used for potentially the aging human. What does it do? Chronic Cibinetide treatment mitigated age-related increases in the cardiac non-myocyte to myocyte ratio, infiltrating leukocytes and monocytes, pro-inflammatory cytokines, total NF-kappa B, and so forth. So the methods, let's see, integrated longitudinal, they had 48. Again, they used the rats. What do they do here? So chronic treatment with Cibinetide reduces systemic inflammation by decreasing susceptibility to diet-induced insulin resistance, neuropathic pain in patients with type 2 diabetes, and sarcoidosis-associated with small nerve. Okay, we know about some of that. We talked about some of those studies. So additionally, Cibinetide administration to rats improves survival following myocardial infarction, reduces organ dysfunction in mice during hemorrhagic shock, and suppresses development of atherosclerosis in hyperlipidemic rabbits. Again, I have a thing about giving rabbits a high-fat diet because they're typically fed a vegetarian diet. So I take that with a grain of salt whenever you do a rabbit study. So what did we do here? Cibinetide treatment mitigated age-associated left ventricular function decline. Cibinetide treatment significantly mitigated the age-associated increase in left ventricular volume at end systole by approximately 75%. Although Cibinetide treatment did not significantly impact the age-associated increase in left ventricular volume at end diastole, it significantly blunted the age-associated decline in ejection fraction by almost a half due to its effect to reduce LVES. Pretty cool. So, we have any cardiologists in the chat? Maybe. Huh? Systemic frailty in late life was ameliorated by Cibinetide treatment. Rats treated with Cibinetide scored significantly lower on the overall frailty index. So these rats, as they age and their fur looks a little bit mottled, they move a little bit slower. And so when you look at rats, that's how you assess if they're old and decrepit or not. And the Cibinetide seemed to ameliorate, things like loss of whiskers and stuff like that. Old mice phenotype. Cibinetide diminished the age-associated increase in myocardial inflammatory cell infiltration. That's pretty cool. Age-associated lipofuscin accumulation was reduced by Cibinetide treatment. The accumulation of undegradable cellular wear and tear byproduct, lipofuscin, widely recognized to increase with aging and reflects an impairment of protein recycling mechanisms, was reduced with Cibinetide treatment versus saline treated cardiomyocytes. So this is like a petri dish study. Let's see. Did you know that you can measure the blood pressure of rats by their tails? I didn't know this, man. This is what this study did. So Cibinetide treatment reduced tail blood pressure elevation with age. Cibinetide mitigates oxidative stress and damage from allopathic cancer treatment. Well, this is something that was surprising to me. Our findings corroborate previous studies that identified the protective role of cibinetide to moderate the cytotoxicity and genotoxicity and oxidative stress induced by chemotherapeutic agent doxorubicin to reduce radiation-induced cell apoptosis, oxidative stress, and inflammation when administered as a nanoreactor, and to improve glucose oxidation rate, ATP production, and enhance glucose-stimulated insulin secretion in experimental models of diabetes. So that's amazing. What else? Aha, this inflammatory bowel disease. So if you guys are investors, ARAM is the company that's developing cibinetide. Now, it's it's a peptide that you can get from some compounding pharmacies, underground labs, but this is potentially going to become a big pharma drug developed by ARAM, and it is showing evidence to modulate inflammatory bowel disease, IBD, and IBS.
It's not FDA approved yet, right?
No, they're working on it.
Yeah, if it's approved, that we can start doing a compounding formulation. But I don't know, Jay, do you think things will open up and you can
You
compound it
can.
with?
So I came across this drug from several compounding pharmacies, not Strive, but some other ones. I'm sure Strive can get it.
Jill, can you do something about it? Miss here.
We'll talk to her a little bit later. So yes, it can help with IBD. So Cibinetide treated mice were found to have preserved intestinal lamina propria tissue integrity due to reduced infiltration of myeloid cells and diminished production of pro-inflammatory disease mediators, including cytokines, chemokines, and nitrate synthase 2. Cibinetide effects were dependent on IR-JAK2 functionality and were mediated via inhibition of NF-B subunit. Okay, interesting. Let's move on to with the next colitis, more on the colitis issue. Um, Two distinct forms are present. So we got EPO and then we got Cibinetide. Let's see what they do here. Okay. Um, we use dextrans sulfate. So this is a toxin to induce colitis in the rats. Again, these poor rats. Once colitis was established, mice were treated with the solvent, EPO, or Cibinetide. We found that both Cibinetide and EPO ameliorated the clinical course of experimental colitis in mice, resulting in improved weight gain and survival. Correspondingly, the DSS, which is the toxin-exposed mice, treated with Cibinetide or EPO displayed preserved tissue integrity due to reduced infiltration of the myeloid cells and production of pro-inflammatory disease mediators. Here's a little bit more on that. The Cibinetide dampens innate immune cell function, thus ameliorating the course of experimental colitis. Cibinetide inhibits immune cell influx into the colonic lamina propria. So treatment with EPO or Cibinetide resulted in reduced accumulation of neutrophils, monocytes, and eosinophils in the colon. In addition, we noticed significant reduction in CD4 T cell numbers expressing either IFNY or IL-17 in the colon of mice having received EPO or Cibinetide as compared to control treated. Phase 2 clinical trial on the use of Cibinetide for the treatment of diabetic macular edema. So, methods. Naive patients with greater than 400 what is that? Picocentimeters? Central retinal thickness in one both eyes were recruited at Belfast Health. So finally, we got some humans here, no more rats. Patients self-administered Cibinetide 4 milligrams a day, sub-Q for 12 weeks. Primary secondary outcomes were observed at 12 weeks based off visual acuity, central retinal sensitivity, tear production, and patient-reported outcomes, adverse events, and antibodies to Cibinetide. Results, 9 patients were recruited, 8 completed the study. Let's see, there was no improvement in mean change baseline week 12, central retinal sensitivity or tear protection, but there was improvement in National Eye Institute Visual Function Questionnaire composite scores. Some participants experienced improvements in tear protection, diabetic control, and albuminuria. No serious adverse events or reactions to Cibinetide or anti-Cibinetide antibodies were seen. So conclusion, the Cibinetide 12-week course was safe, right? So if it's safe in human use, at least 12 students, 12 of these patients. So you can see some their their changes here. I actually noticed that they had a little bit of triglyceride improvements with the Cibinetide treatment. The glucose, I think, improved as well. Some diastolic blood pressure improved, like not significantly, but it did improve, same as the systolic blood pressure. So you can see some little improvements across the board. I'd like to see a longer study to see if you could see even further improvements in diabetic patients. The discussion of the 9 patients. 3 of 9, 33% of the eyes had a reduction in CRT beyond what could be explained by retest variability. Cibinetide may lead to visual improvement in eyes with milder forms of diabetic macular edema. Moreover, improvements in central retinal sensitivity were observed often in fellow eyes, more often than in study eyes. The former had milder edema than the latter, further suggesting a potential benefit of Cibinetide in retinal function in earlier disease. So maybe if the eye is too far gone, you can't reverse it, but if you hit it early enough with a regenerative peptide, maybe the eye can come back. And 4 mg seemed to be the dose. Maybe they could have done better with 8 mg. And let's see, Cibinetide enhances endothelial stem cell mediated vascular regeneration for the treatment of retinal ischemia. They did it was in vitro. Um, not hugely impressed by in vitro. The non-erythropoietic EPO analog Cibinetide inhibits osteoclastogenesis in vitro and increases bone mineral density in mice. Uh, yeah, I don't know about this so much. Makes maybe a little bit of sense. I'd have to see some human studies to believe it. Just the impact on human bones is like greater than like mice bones. They don't weigh much in the first place. So, but kind of cool. They see some improvement for bone health in mice. So conclusion is a synthetic oligopeptide rationally designed to selectively affectate the IRR. Cibinetide interacts with the external hydrophilic domain, EPO, complex and has been shown to exert beneficial effects in animal models of myocardial infarction, dilated cardiomyopathy, experimental ischemic stroke, peripheral nerve trauma, and wound healing, as well as macular edema, preeclampsia, as we saw earlier, sarcoidosis, and small nerve fiber neuropathy. The best part about it, it doesn't seem to have side effects. It doesn't have the erythropoietic effects that you have when you use EPO, blood clots and so forth, higher blood pressure for more red blood cells. So I'm pretty excited about this drug. I'm curious to use it on patients with small nerve fiber neuropathy, who need wound healing, maybe some diabetic macular edema. And I found this through the compounding pharmacy. So we have access to this drug right now. What do you guys think of this? You guys gonna start using it? Yeah, it's the first I heard of this one too.
It looks like something that's really great to add to.
Yeah, add to the stack, add to our toolkit.
Yeah, I think ARI it's a great product, and it's derived from erythropoietin.
Yeah.
And erythropoietin it's a growth factor. It helps stimulate the production of red blood cells, and also it's neuroprotection as well. So it's good. It's a regenerative peptide. That's true. It has anti-apoptotic effect, and it has anti-inflammatory effect and anti-inflammatory by inhibiting the inflammatory cytokines, which is like tumor necrotic factors.
Yes.
And I think it does have it's very good in restoring the neuroplasticity, abnormal neuroplasticity, especially in pain. There's abnormal neuroplasticity, and it does restore that neuroplasticity back to normal. So that's why they use it for central pain and allodynia, which allodynia is part of central pain. Again, loading it with cyclodextrin and delivering it intranasal will be the best option for this drug.
But
So
the studies are on subcutaneous injections.
right, that was good too for the subcutaneous injections. I can see, but still, all the peptides, even proteins, it can. There's a very good nice articles. You can help them to prevent them from being degraded easily by the tissue enzymes when you inject them, and last longer if you load them with cyclodextrin. That's the direction of what we're going to do with peptides and any proteins to and decrease the biodegradability of those drugs and enhance the pharmacokinetics. But it can be done intranasal. If you load with cyclodextrin, then it will go through endocytosis and get into the brain and helps the patient with central pain and restore the neuroplasticity. I think it's a good drug, especially as I said for the ophthalmic retina problems, patients with glaucoma and have retina problems. It does help to restore some functions of those neurons, especially the stunned one, the inflamed one. I don't know how much it's going to do with the dead one and replace them. I mean, it does may stimulate the stem cells of the neurons. That's right. But and it helps the stunned neurons to recover. So it's good for all neurological diseases. All the neurological diseases you can use it as anti-inflammatory and anti-apoptotic. Parkinson disease, Alzheimer's, stroke, central pain. It does have some tendency in rejuvenating the and restoring the normality of the nervous system. Specifically, if you see the application, most of it's all about neurons, ARI. There is not much of application done in the joints, but most of the applications it's in the neurological applications, and that's a good thing. But loading it with cyclodextrin delivered intranasal or sublingual and getting it into the blood topically, it's possible. I don't know about the size of it, but there's possibility that will be.
Yeah, well, the problem I have with the cyclodextrin, because I've been using it, is that they spray it up the nose and then a lot drips out. And the dose is very specific for Cibinetide. If you want a therapeutic effect, it looks like 4 milligrams minimum, but 8 milligrams better. So you don't want to waste any.
Right, you can use. I mean, come on, we use. Yeah, you can get to that dose with cyclodextrin. The problem is that that's technical problem, not the reality is that with gel using sonication and using more advanced technology, then he will be completely break it down and remove all the debris by nanofiltration. There's a nanofiltration that's not being done with just mixing it like this and just no. Nanofiltration will help to remove all those smudge and then making sure that they do the buffering and add something that helps to decrease irritation, and then you end up with a very good results with intranasals or spray or even subcutaneous. You can still do those injectable with cyclodextrin subcutaneous, but adding cyclodextrin helps them from breaking down by the tissue enzymes. That's the reason the efficacy will go 10 times if you're able to increase the lifespan and the half-life of those peptides in general speaking.
Yeah, Stefan, I got a couple of comments here. You know how we always hang our hat on the pillars of efficacy, safety, and affordability. The studies that you show are really dedicated to a lot of efficacious use of this product. But the thing that jumps out in my mind is the safety. This is incredible. This is almost like a no-brainer. And I don't know if everyone would consider this a first loss and a first usage in things like IBS or something like that, or is it something you would reserve. I don't know that. But the one thing I want to mention is that the affordability, I don't know if you said much about the cost on this, and my guess is, of course, that it's going to cost a lot more if these guys get FDA approval and put it out as a drug. It's going to be really, really expensive. So what I think I'm going to do is I'm going to talk to Judge Ben and find out if we have something like this on in our compendium before the FDA approval of the drug comes out. Will we still be able to get the raw product without having to go through the prescription product? That's something that I don't know, but I've always wondered about that. So I'll see what he says about that in case you're interested.
Yeah, it doesn't look like it's uh too cheap of a peptide. It looks like you can get 8 milligrams per ml in a 7.5 ml vial for like $230.
Okay, so how 8
So,
milligrams per ml and what size vial?
so we got 8 times 7.5. So that's 60 milligrams you can get for like $230.
Okay, and eight per ml. Okay, so the dose you'd start out with is half an ml for the 4 milligrams, and that's still that's a decent size sub-Q injection,
Yeah.
right? So Dr. Halas has got a point. If there's another way to give it, hey, great. But again, my thing is that if Big Pharma or whoever these Aram or whoever these guys, I'm not familiar, if they come out with this as a drug, I can see the cost going way up, way
Yes.
up. So I'm going to just give them a quick query to find out in general, what if there's things that we can get now that we can stick on our compendium, our formulary, that we can get grandfathered? I don't know that. So I'll find out, see what he says.
Yeah, we can get it now at various compounding pharmacies.
Well, if we prove that if you load it with cyclodextrin, the efficacy goes 10 times, then the dosage can be that will increase the cost. In other words, it will increase the efficacy of it. If you said, okay, with
So yeah, use less.
with cyclodextrin, it will be you just need 1 milligram, and you have the efficacy of 4 milligram. So that's the reason the delivery and the base does help to enhance the active ingredients if you have the right base that helps to change the pharmacokinetics. But that needs to be tested.
Yeah.
In general speaking, there's publications already showing in general that cyclodextrin does still increase the efficacy of all the peptides in general, and all the improve the peptides stability,
Yeah.
affinity, and all that stuff. You can see many
Yeah.
articles on that,
Yeah.
which
Yeah.
ARI can be part of it. So that's
Yeah.
that's
The
the idea.
kinetics is going to change. If you use intranasal as opposed to sub-Q, it'll change. And I don't know, you might have said, Stefan, I don't know, but the duration of action on this, there was that one thing where you said they were talking about using it daily,
Daily.
that type of thing. Did you say, is that more for acute type of situations?
No, there's no acute studies well, yeah, I guess
Like,
they would induce the preeclampsia and they would induce a
yeah,
myocardial infarction. So that's an acute use of it.
any IBS and all that.
Hmm. Yes, but in the human studies, like it was chronic stuff. It was chronic macular edema. It was chronic like small fiber neuropathy pains, and so they would use it for like 28 days and see some improvements.
Yeah, and
So
then I wonder, do you do a maintenance after that?
Yeah, it sounds like it. It sounds
yeah,
like you would need to do a maintenance.
And then, like Dr. Alasa said, if it is able to be loaded in cyclodextrin and all that, then the cost would obviously come way down.
yeah, if you show the enhanced efficacy and naked versus like the same thing for doxorubicin and Doxil. So doxorubicin is a naked chemotherapy, and then the big pharma took it and loaded inside liposomes, and they selling it in the form of Doxil. And you need 10%, maybe 20% the dose of doxorubicin, and it has less toxic because of the liposome that they are putting in. So that can be applied the same thing for any drug or any peptides. If we if we loading inside sarcoidoxin, we may enhance the efficacy, and that will definitely it become the price. Then you maybe need 1 milligram a day, and it does the effect of 4 milligram. So that's like 4 times decrease in the price. If this work, I don't know. Can we stop the recording so we can talk
Yeah.
about other thing, please?
Yeah, that was good. I'll make it stop here.
Can we stop the recording? Sheldon, can you stop the recording, please?
Stop.
Yeah.